Let's talk about IV fluids and their types. IV fluids or intravenous fluids are fluids administered directly into the veins of the patient. And before administering any type of intravenous fluid, it is important to know what this fluid is and how it affects water balance in the body. That will lead us to body fluid compartments. We've been hearing that the body is made up of mainly water, and this water component of the body accounts for about 60 to 70% of the total body weight. So this body fluid compartment is divided into two compartments. We have the intracellular fluid compartment and the extracellular fluid compartment. The intracellular fluid compartment refers to the fluid that is inside the cell. That is the fluid that is within the cell. And this accounts for about 40% of the body weight, while the extracellular fluid refers to the fluid outside the cell. And it is further divided into two types. We have the interstitial fluid, which is in the interstitial space. Interstitial fluid, which is the fluid that is within the space that is between the cells. That is the interstitial space. And we also have the intravascular space, which is the plasma or the fluid that is circulating in the blood vessels. The most important factor we have to consider before administering any intravenous fluid is the tonicity of the fluid. The tonicity of the fluid refers to the relative concentration of solids in the fluid versus plasma. This means the concentration of solids in the fluid compared to the concentration of solids that are in the plasma. And it has a role to play in the movement of fluid from the intracellular to the extracellular space of the body. Based on tonicity, we have three types, which include the isotonic, the hypotonic, and the hypertonic solutions. We are going to define these solutions one after the other. So the first one we have is isotonic fluids. As the name implies, it refers to fluids that have the same osmolarity or concentration as plasma. That means their concentration is the same with that of plasma. And because their concentration is similar to that of plasma, it does not cause any fluid shifts from the intracellular to the extracellular compartment or vice versa. Typical examples of these fluids are the 0.9% normal saline and the lactated Ringer's solution. These fluids are used in cases of hypovolemia or dehydration. It's also used in cases of burns and fluid replacement during surgery. And they are also known as plasma volume expanders because they increase the blood volume. So when your patient is taking these isotonic fluids, you want to monitor for signs of fluid overload because this fluid go to expand the plasma. So you monitor for signs of fluid volume excess such as edema and shortness of breath. If there is fluid volume excess, it's going to place extra workload on the heart, which can lead to hypertension and heart failure. Now let's talk about the hypotonic fluids. As the name implies, it says hypotonic fluids. It means that it has lower osmolarity or concentration than the plasma. That means the plasma is more concentrated than the hypotonic fluids. And these fluids are used in cases of cellular dehydration that can be seen in diabetic ketoacidosis and hypernatremia. In cases of hypernatremia, there is fluid shift from the intracellular compartment to the extracellular compartment, leading to cellular dehydration and possible hypervolemia. So in this case, you want to use hypotonic IV fluids to reverse the cellular dehydration. Typical examples of hypotonic fluids include the 0.45% normal saline, which is also known as the half-strength normal saline, and the 0.33% normal saline, and so on. When administering hypotonic fluids, it is important to note that these fluids move water from the extracellular space to the intracellular space. So you want to monitor this patient for signs of tissue edema and dehydration because fluid moves all the way from the extracellular space into the intracellular space. So you want to make sure that there is a balance between the intracellular and the extracellular space. Let's go over to the third type of fluid that we have, which is the hypertonic fluids. Hypertonic fluids have higher osmolarity or concentration than the plasma. It means that they are more concentrated than plasma. Because of its hypertonicity, it moves fluid from the intracellular to the extracellular space. So in this case, you want to monitor for also for signs of fluid overload, because fluid will be coming from the intracellular to the extracellular. You also want to make sure that there is no depletion in the intracellular fluid, because it would cause more problem for these patients. Typical examples of the hypertonic fluids are the 3% normal saline, the 10% dextrose in water, and the 5% dextrose normal saline. This fluid will make water to move from the intracellular space to the extracellular space, and it will cause shrinkage of the cell. So you want to be extra careful so that there won't be complications after administering the fluid. Typical uses of this fluid include cases of hyponatremia, where there is low sodium levels in the body. It's going to cause water to move into the cell. So you are going to correct this condition by administering hypertonic IV fluids to balance the intracellular and the extracellular. Remember, we said that the hypertonic fluid draws water from the intracellular to the extracellular compartment. It's also used in cases of cerebral edema, when there is excessive water buildup in the brain. It helps to pull out fluid from the intracellular compartment of the brain to the extracellular compartment, and thereby balancing intracranial pressure. Now let's look at the general considerations for all IV fluids. You have to review patient's electrolyte levels, because intravenous fluids could alter electrolyte levels of the patient. So you want to make sure that there is a balance between the electrolytes and the fluids. You also monitor the input and output of this patient, because it tells you how hydrated this patient is. And it also gives information about how the kidney deals with the fluid. You also want to monitor the vital signs and the weight regularly. You also want to use infusion pumps for hypertonic solutions, because the infusion pumps deliver the intravenous fluid at a very accurate flow rate. You also want to make sure that the IV fluids are labeled clearly so that there won't be any medication errors. We will draw our curtain here for this video. So do well to like, comment, subscribe to this channel so that you'll be among the first people that will receive a notification when there's a new video. And also share this video with your colleagues. Bye.